Welcome back to First Edition. 1 week from today, Metro Ministries invites you out to take part in their annual Poor Man's Supper. Patty Clark joins us once again with the nonprofit. So good to have you here back again. I wanted to get you in because we have more time to chat right now.
I appreciate that.
And that's what we want to do.
Right.
First, let's take a look at the main guest of honor, if you will. The Poor Man's Supper. Explain how this works again for viewers that might be unfamiliar with it.
So our Poor Man's Supper, 34 years this year, was started as a way for our donors to understand who we are, what we do, how we serve. And so we do serve a very simple meal in a bread bowl. Now, this is kind of like your side view mirror. Our objects are larger than they really appear. So on the night of the event, your bread bowl will not be quite that big, but conceptually, it's a stew served in a bread bowl, and there's a real skill to using your bread bowl.
To eat out of it,
To eat
right?
it, yeah. A lot of people fill the stew, they use the top to dip and bite. Others will hollow out the whole thing, save that for last. It's just really interesting to walk around the room and see, you know, everybody's technique. But it's a reminder that that might be the only meal someone's going to have today.
Exactly.
And they're going to have to stand in the line to get it. You know, they wait to be served and they go and they sit.
Metro Ministries, y'all are located off of Leopard, downtown.
1919 Leopard at Doss.
And you do more than just one thing. You have several programs there.
We really do. You know, we were founded in our first meal was served in 1983 through our Loaves and Fishes cafeteria. And most people in the community know about our cafeteria. And it's daily meals, lunch and dinner, Monday through Friday, with a special meal on Saturday. We're averaging about 1,300 meals every week.
Is that more than what you're used to seeing right now? I know things are different during the pandemic.
Right. Well, but we stayed open.
Yeah.
We continued to serve. We served externally, but we've seen where we see the greatest need is in meals served and in healthcare. That's where we see our numbers really continuing to grow. So in our Loaves and Fishes cafeteria, we see a lot of families in the evening and on the weekend. We know it's important to serve a nutritious meal because a better meal, better health.
Is that something where people come in, you don't just feed them and that's it, you have a chance to visit with them, see what those needs are? What are the greatest needs right now in the community?
Greatest needs are access to health care and served meals. So we've always had a branding problem. You know, Corpus Christi Metro Ministries makes it sound like we are a church, and we are not. While we were formed by the faith-based community, we have 5 very holistic programs that work together for transitional living, for better health, independent living. So Loaves and Fishes came first. Then we started with residential programs, our rustic house for gentlemen, our rainbow house for women, children, and aged out fosters, our vineyard social services for the community, and where we're seeing great need is through our Gabbard Health Clinic.
Okay, I want to talk about the Gabbard Health Clinic, but I also want to talk about aged out fosters. What beautiful children. I mean, they're becoming adults.
It's tragic.
They don't have families after they leave if no one's adopted them. What is that? What is life like for them right now? What are you hearing from them?
It's a broken system. Anyone who's in it will tell you it's a broken system. So when we have the opportunity to receive an aged out foster, and right now we're only able to accommodate young women just because of our space limitations, we just wrap all those services around them so that they have the best chance for an independent life. And so this is a great segue to talk about our speaker this year.
Let's talk about that.
Is our first aged out foster. I cannot say it without having goosebumps. I'm getting chill bumps and a little emotional when I talk about it.
Why is that?
Because we became her family when she had none. We became her tias and grandmas and mimas to help her finish her high school education, get her graduated, get her set up in school, take care of her while she went to school. I went to her not her high school graduation, but her college graduation, and now she's gone on and completed her master's and is now working at the school where she attended as an undergraduate and as a master's candidate.
So it's not just somebody coming in from out of town talking about the situation, it's somebody that's lived through it here at home, knows exactly what kids are up against.
Right. And the numbers keep getting worse.
Yeah.
As far as success. It used to be about 3% of those aging out of the foster program would go on to complete higher education, and that number's down to about 1%.
So she's the exception and not the rule.
Absolutely. She's that starfish.
We only have a few seconds left. The healthcare center that you have.
Gabbard Health Clinic.
Yes.
We remained open during pandemic, and that's where we saw our patient numbers increase. So we have doctors and a nurse practitioner and volunteers that come Monday through Friday, 9 to 4, no appointment.
Walk in.
Just walk in, be seen, and it's just it's an incredible thing to witness when folks come in and leave with care and but most importantly, we've helped restore a little dignity to their life.
I think that's probably one of the most important things. Not being afraid to, shoulders back, chest up, head high. I know there are people there that care, and there are resources like yours.
Yes, and they are
successful.
seen. People feel
Yeah.
seen when they're with us.
Patty, always a pleasure. We're going to
Thank
put
you.
this interview on our website at KIIITV.com. Poor Man's Supper is 1 week from today. We hope you have a chance to take part in that, and I believe I'm sending it over to Carly right now. Carly?